Going to go back into the KUM News Zoom room now, where Dr. Hoa Nguyen is the founder of the American Medical Center. That's why I got it, Red Doc. I've been saying it so many times. I have to remind myself a couple times. But good morning. Good to see you, Doctor.
Thanks for joining us,
Good
Doc.
morning.
Just wanted to get you on and kind of get your reaction to President Biden's announcement about, he's making big plans to combat the Omicron variant. What was your takeaway from that, Doc?
Yeah, it's right now, as you know, when the Omicron was out sometime in November, early December, we say that December is going to be taking over the whole United States sooner or later by sometime December. So right now, with all the cases positive in the state, about 70 or 73% are all Omicron. It's really spread very, very fast in the state. And I think everyone right now, we know that the symptoms are somewhat mild, but we're going to wait for about a week to 2 weeks to see if the hospitalization in the state are going up or not because of that. I think that's why they all worry that will be overwhelming the hospitalization again for the state. But we keep our fingers crossed. Right now, I think the hospitalization is up about 4%, so it's not that bad. But going to the holiday with the influenza on top of Omicron and some of the Delta still there, they just worry about that the hospitalization will be overwhelmed again, like the last surge. But I think that they are prepared to do a lot of testing. I know they bought a lot of tests to give out to people at home to use to do self-tests. And that's just one way for people to do. And we see that in Guam already. We see quite a few people that the past few days that test positive at home as a home test, and they come into a clinic for confirmation tests. So we're really glad that people are doing that and take the initiative to protect themselves and their family. So it's very good. So those are good. There's a lot of initiatives there, Chris, that Biden have, and I think that it's very aggressive. But I think it's good at this point because we go into the holiday when there's a lot of gathering, and you can see. I went to the mall the other day, it's like you do, and just the mall is packed. So there's potential. There's a surge there if we don't use our masks and do the right things. So it's okay. I think it's well worth the time we want to do that.
Doc, what's your message to people out here as we prepare to celebrate Christmas?
So what I do is that we see probably starting this week that we see that some people on the flight that flew in from the state and they get sick a day or two when they get here. So that means that they don't get the virus from here. They bring it from the state. So even our policy in the clinic now that if you have a history of travel from the state to Guam within 1 week and you are positive, we're going to repeat the swab and do a PCR and send that to public health to request for the genome sequencing, just make sure that it's not Omicron. We see in the clinic about 3-4 cases already. So that people are doing fine on the plane when they get here. They get sick on the next day, and then they come in test positive for COVID. So I would say that if you have relatives that come in from the state, please really watch the symptom. The symptoms are very atypical. It's like body ache, fatigue, headaches, a little bit of cough and cold. There's no fever that we pick up at, but they all test positive. So if you have relatives coming from the state, please watch it. Get themselves tested because you can test everywhere. It doesn't cost anything. So please go to TGen or to clinic, get tested, and make sure that you protect your family and the people that come and visit you. So pay real close attention. I say Omicron probably the next week or so it probably be 85-90% of all the positive in the state. And it's very infectious, much more than Delta. If someone coming from the state again that will visit you, watch for their symptoms, they have a symptom, you can do a home test if you want. If it's positive, please come to a clinic for confirmation or go to Tijan and have them tested there. But to let them know that you just coming from the state or somewhere in Asia that travel to Guam.
Doc,
Okay, so,
the positives you've been having at the clinic, were these individuals who traveled into Guam, were they vaccinated?
they are fully vaccinated. They have 2 shots. Again, the message to people like this, Chris, that they need to know about Omicron, right? And you have 2 things when you get the vaccine. Omicron, because it's so infectious, you're about 30 to 40%. If you're fully vaccinated, that protect you from getting the virus. Okay. Now that's for getting the virus, the 30, 40%. Now, if you are boosted, okay, then if you get the virus, it's about 75% or so protecting you from getting severe symptom. Okay, so with Omicron, yeah, fully vaccinated doesn't mean that you won't get the virus. I want to make that very clear that this thing is very unique. So you have only 30-40% protected if you're fully vaccinated. So I think during the holiday, the gathering had to be careful, and you need to use your mask in public if possible. I think it's mandatory, but I would use your mask as much as possible to protect yourself. Again, we're going to have some gathering during Christmas and New Year, and hopefully coming to 2022 that we don't see the surge of the case in Guam. So yeah, wear your mask, social distance as much as possible, and wash your hand. Okay, and again, vax or unvax doesn't make any difference. Okay, the only positive about the vax people is that if they boosted, then they have a less chance of have severe symptoms. But that's the only difference. But both of them will get infected if you don't wear your mask and do the social distance and the hand washing. So just use your best judgment as possible during the gathering, the Christmas and New Year, and protect yourself and the family. Okay.
No double dipping in the Finadeni. Get your own Finadeni bowl, right, Doc?
Let's try, but guys, it's really we know that it's going to come sooner or later. I think that public health have a plan together. I hope, and I hope that we roll out the testing as quick as possible. If we see that the number pick up, if we identify a case of Omicron in the community, yeah, we definitely will expect there's a surge, just like the previous one. Hopefully, like I say, it's hold true that the symptom is not as severe.
Yeah, Doc. I mean, I actually interviewed Dr. Bob Leon Guerrero, the interim chief medical officer of public health. It was a few weeks ago, and he said, "Oh, probably it's already here." But do you think if Omicron was here, that we'd be seeing a big number of positives? Or you know what? I don't know, Doc. I think people, if it's mild, then they're probably not going to show up and get tested. So it's real hard to get a read on it, right? Until we send the samples off.
Yeah. I mean, I think we are sending a sample to Hawaii now to get the 4 or 5 days, so less than a week turnaround time. To send the CDC, 3 or 4 weeks is crazy. That's ridiculous. You're way behind the power curve already. But I sincerely don't think that we have Omicron yet on the island. Because I tell you, you will see people come in and you see the case going up. It's supposed to be double the infection rate, every 3 to 4 days. So I tell you, if it's here, you will see the positive take off just like the last surge. So I don't think it's here yet. But the few people that come in from off island that test positive, they are very, very responsible. So I really appreciate them for doing that. They identify the symptom right away and they isolate themselves right away. So I tell you, thank you so much for them for doing that. Because that's really helped our community a whole lot. So again, the message to people is that if you travel off island back to Guam, visitor, if you have any symptom, don't care body ache or headache or fatigue, please come in to get tested. We gotta protect our community here.
Thank you, Doc. Merry Christmas.
Okay, same to you. I'm be off to Florida tomorrow, so on Saturday.
Are you gonna go see your brother?
Yeah, I'm gonna see my mom's.
Oh, your mom. Okay, right. Well, be safe there in Florida because it's pretty wide open.
I know.
Don't lick anything.
Days are going up like crazy, but we'll wear my mask for sure.
All right. Okay. Thanks, Doc.
Thanks,
Merry
guys.
Christmas. Have a safe trip. There you go, Dr. Hoa Nguyen, former chair of the Physicians Advisory Group, Marianas Irrigation and Landscape, your Shinda.